Thank you, Mike. And now for our next keynote speech, I would like to call to stage Dr. Flavio Salio, EMT Network Leader, for an overview and update of the EMT Initiative. Flavio?
Good morning, everyone. Thank you so much for taking the time to join, and I'm really impressed to see so many people joining us here today. What we'd like to start is basically what we came from, in particular from the last global meeting, when we launched a clear strategy and a critical call to actions. The call to action has been very successful when we're looking now after 2 years. First of all, obviously, we call country to adopt and adapt the standards of emergency medical team and investing in developing and strengthening the rapid response capacities. But we said always that at the same time, it's not just a question of building the team, right? There has been a strong asset that will be facilitating and strengthening their own local health emergency workforce. But when we're looking back to the baselines, when we launched the strategy, we have 33% of the countries that they have adopted and adapt the emergency medical team methodology. When we're looking today, only 18 months after, we are already looking at a projection of 48% of the country they have adopt and adapt the methodology of the EMT. When we look at the indicators, we are aiming 70% by 2030. So you can see there has been a significant progress in only 1.5 years. And I think as a result of that, we started to see more and more national teams, local teams has been developed, and they are more equipped and prepared to respond. They will be supported by the peers, the international teams, but we see a lot of emergency responding locally with the strength and the capacity of those. We've seen in the strategy, and that's the main 5, to establish a validation of those local and national teams. We recognize the importance of the international, but we need to find a way to quantify the ability of those national teams to respond and be ready in their own countries. Then I think as part of the strategy, we launched what we call the Training and Knowledge Hub, in way to try to standardize capacity building activities. You can see the picture. So we are seeing a tremendous effort put in place across all the regions. And if you look into the hub, only the hub in Addis Ababa, in the last 12 months, we have seen thousands of professionals that have access to standardized trainings. And obviously, we have seen the impact of that in the ability of the colleagues to deploy in their own countries. We've been seeing already today in terms of the classification. So we have reached 49 and confident that by the end of this year will be the target of 50 international team classified. But it has been a busy biennium as well since we launched the reclassification. And you can see 12 teams that will be recognized as well tonight during the gala dinner. Of importance on this slide is we have received since the last global meeting 60 new expressions of interest. So in less than 2 years, we have received 60 more teams that they apply to the classification process. And when we look into the details, 1/3 of those 60 teams are represented by NGOs. And most of these NGOs have responded, have been exposed to the initiative, and now they're coming forward to be classified as emergency medical team. Then, a part of the strategy, we look into a more agile the concept of modularization for emergency medical team. I think this concept of specialized care team is becoming reality. Thanks, as in the picture you can see, thanks to the UAE and the Department of Health, I think we had significantly advanced in the standardization of the response to CBRN events, as well as starting the work on mental health and psychosocial support, as we agreed back in 2022. In addition to that, and it's very relevant for the events of today, we have developed tools to facilitate the work of teams working in insecure environments and in more challenging situations. The theme of the 3 days is as well innovation. So we definitely want to look into not only on the technology, in which we do see play a relevant and important, it will be an important asset in the future, but at the same time we want to look into this innovation, that how we can respond it with fewer resources, in a better way, in a proper way, even in situations where we do have limited transportation, access to water, and health infrastructures. We'll be looking to as well to validate some of the innovations and test it in the training and knowledge hub that we have, and pilot in some of the selected countries. What we've done as well since 2022, we launched the call for support of the EMT Initiative. It's a way to recognize the outside of agencies, they have the ability to build emergency medical team. There are a lot of other institutions that can bring technical expertise, research aspect to build and helping us to moving forward the initiative itself. As of today, we have received 34 new supporters of the initiative, and we are in the process to have them part of the network. Sorry. And lastly, I think we do have the opportunity, obviously, to join effort with other networks, as has been said already before, collaborating with other networks, expanding the pool of capacity at countries and globally, in particular to ease the coordinations and facilitate the support to the populations that we serve. As mentioned, I think EMT can play a vital role as part of that, and in particular to strengthen, obviously, those capacity at country level to allow them to respond. Lastly, I would like just to say we are referring to teams, but I think we're not only talking about teams, we are talking about the architect of a more resilient system that can support preparedness and response to emergency. And this, we have another example as well of the achievement done, as we said, and will be 100% sure by 2025, we will see all regions having classified emergency medical team. I would like just to conclude to say we have done great, but I think we can do more. So let's challenge ourselves to make sure that every country, every need, and everyone will be part of the response. Thank you so much.